Good afternoon, Dr. Barrett. Dr. Noonan, I'm still in the habit of calling you Dr. Barrett. I know it's Dr. Lynne Noonan now. I'll probably just call you Lynn from this standpoint. But thank you for joining us today and being willing to share your experiences. As you know, this is a series I'm working on to get providers with different points of view and different experiences on using telehealth. And just share this with the general public as part of my training webinars. So maybe if you could just start us off with just a little bit of introduction about your credential and how you came to find yourself in the telehealth universe.
Well, I've been seeing patients since 1999 and had a private practice where I saw people in person. And I was actually working at the Naval Hospital in Beaufort when COVID hit. And we initially switched to telephone calls. Then we used Google Duo until it was safe to see patients again. And that was it just depended on how safe our area was as to what modality we did in our clinic. And now I'm in private practice in Waynesville. And again, I'm using telehealth as a part of providing services to people who don't feel safe coming into my office.
Okay. So you actually started with the oldest form of telehealth, which is over the old telephone lines. I don't know if you were using copper line, the wired lines or not, but that is the oldest form. How would you assess your experience between the telephone only service, because that's under review as we speak today, that's under review at the federal level. How would you characterize that, and then video conferencing, and then if you want to face-to-face in room?
Okay. Telephone is, I think, more difficult. Simply because you can't see one another, and so you don't have any visual cues that I think are very important in therapy. So that's the most difficult. If you had a relationship with the patient before starting the telephone interactions, that was better than not having seen the person at all. And then in comparison, using telehealth formats is much better, but it's also more taxing, I think, probably for both. There are some positives about it, such as, you don't have to spend money to get to the therapist's office. You don't have to wait in the waiting room. And for some people, that reduces stigma for them because they don't have to go out of their home. So there are some positives to using telehealth, but again, I don't think it's the same as sitting in the room with someone else and actually being able to see them and be with them, because on telehealth, as you can see, we see each other, a portion of ourselves, and that depends on how close or how far away the person is from the camera. Sometimes you can only see their face. And so that again cuts off some sometimes important cues about what's going on that I might be able to see if the person were in front of me.
Right. And one of the things you just mentioned right there, it matches with the outcomes from Stanford University studies around Zoom fatigue. And that is that it's when you're up like this and you have this more narrow focus, it's much more cognitive overload than if you can back up, and like I'm using an external keyboard that gives me some distance here. So that's one of the 4 key factors they found about what leads to Zoom fatigue.
Yes.
Now, I remember one of the things that stuck with me when you first went down to Beaufort was, and for those of you not in the know, it's Beaufort, North Carolina, and Beaufort, South Carolina.
So that's correct.
Let's be culturally appropriate here. One of the things I remember that stuck out was you said you were a Marine asset working at the naval base. So right. As a Marine asset, were you providing telehealth services all over the world or more of a local region when you were serving our veterans?
I provided services there to the active duty. At the beginning, it was to retirees, dependents, and active duty members. And then our clinic shifted to an active duty clinic only. And it was for active duty Marines and sailors, enlisted and officers, and some of the specialty divisions like drill instructors, recruiters, pilots. So we saw the active duty people mainly in Parris Island and from the Marine Corps Air Station and from the Naval Hospital.
Okay, so it wasn't an international connection. Okay.
No, a lot of the people who are deployed have assets that go with them so that they have access to, not in all places, but where it's appropriate they do, or where they can.
Okay, all right. So have you noticed, and this is just my ignorance, have you noticed any particular difference in working with our veterans and their family members from working with the general public? Let me not speculate.
The main difference for me is that when I was in private practice in Waynesville for many years, I saw mainly women, and I would say less than 5% men as patients. When I transferred there and worked at the Marine Corps Air Station and at the Naval Hospital, I saw probably 98% men. And it was a lot younger age person. I saw people from ages 18, and some of the people who had been in longer, of course, I saw older people than that, but it was a lot of young people. And that was the main difference for me in seeing them, was just the switch from a female population to a male population. And then they have their own language, a lot of acronyms, a lot of things that I had to educate myself about in order to interact with them and learn some of the, like when somebody comes in and tells me what their job, what does that really entail? And so I would have to look that up and learn about their jobs and the expectations for them in order to be able to help them as best I could.
Right. And did you have to learn all the ranks and how they fit together? And
I had a chart. I had a chart so that I could see in relation, because the Navy and the Marine Corps are different in their rank structure. And so I did have something that would help me with that. And like I said, I would look up their occupational codes and find out about their jobs as well.
Okay. All right. I've had, having not served myself, but having worked with some veterans, and they come in and talk about their rank, and I have to get them to say, I'm sorry, but I'm ignorant about rank. Could you tell me what that means?
Right.
and they were all great about it and seemed to understand that.
Mm-hmm.
We all know that telehealth is not for everybody.
Right.
When you're doing your initial assessments, what do you look for in terms of, is this person appropriate or not appropriate for telehealth?
Well, we start out by talking about expectations. And by the time, like, I've got a little short list here, like we talk about cancellations and no-shows, what's expected. I tell them that I will be sending them the link. They will be, answering the link. So I would be initiating the call. We talk about proper attire for telehealth and settings for people, and the expectation that they will be alone in a private area where they're not interrupted. And we talk about things like background noise, so that we can kind of cover some of the problem areas first. But in terms of patients that might not be suitable, and sometimes that may not be apparent at the very beginning, but I will have, by the time I see them the first time, even with telehealth, I will have sent them out paperwork so that I can do screenings for depression, anxiety, PTSD, adverse child events. And so I have that with me. But if people who are usually not suitable are people who have serious mental health issues that could be at high risk, severe depression, especially with suicidality, impulse control issues, or people who have had violent histories, and children, of course, without parental support. And one of the things I also do at the very beginning of every call is ask, where are they? And I write down their physical location. I get an emergency contact number or review it if we've already talked about that. Is that the same today? And I'd go over the number. And then I ask about privacy every time, just to make sure that people, because I have had times where a roommate or a spouse might walk through, or their pets come in, and it makes it's difficult to do this way anyway, and it's even more difficult when you have distractions.
Yes.
Yeah.
Small children at home running, jumping in mom or dad's lap, and
right,
things of that nature, for sure.
Right.
Yeah. Yeah. And the domestic violence aspect, I've had a couple of folks that literally drove somewhere else, and we did their session over their smartphone for that privacy point of view.
Right.
And so, yes, absolutely, that's something you got to be clear about. Beginning and end. The impetus, is that the right word, is on us as the professionals to do what we can to provide a safe environment. I mean, obviously, we can't do everything, but
right,
their attention.
And I think it's us setting those boundaries, like the expectations for what it means for us to be as professional as possible, although we're adapting to something new, and probably they are as well.
Yes. Yeah. Have you noticed at all that people who have not done this before, done video conferencing or Zooming, to use the verb, have you noticed that they find sort of a sense of accomplishment when they finish, when they've not done that? And then I'll tell you my experience, but I'm curious about yours.
I think because I started with the younger people, most of them already knew how to do these things and were very comfortable with it. On those occasions, what I had to do is delineate between what's professional and what's not, like someone answering in their pajamas, or very obvious things like that to make it more professional. But yes, with older people, even me sending them the electronic documents that I do before they come in, that has, when they get it, it is more, it is a satisfying thing for them. But sometimes I've had people say, I just can't do that. You'll just have to give me mine once I get there, and we'll take time out of our appointment to do that. So I've had both experiences.
Yeah, and I found that same age generational breakdown. And I've had 2, 3 at most people that it just wasn't going to work. And I'm happy to coach people and walk them step by step how to do it. But I think for the majority of the ones who weren't comfortable, I'm trying to keep an eye out to see whether, is it true that they do feel a sense of accomplishment? Do they seem to have had a victory? Because so many of our people haven't had victories in life for a while.
Right.
And I'm just curious. It's a small sample, obviously. I'm just curious whether that leads to something positive for them. What are some barriers, if any, that you haven't mentioned? Are there other barriers that you've run into for people being successful, or your success at providing the service?
Well, I changed, when I came back to private practice, I changed platforms from what I had been using at the Naval Hospital. And for me personally, it was just a matter of getting used to my platform and how it worked. And I think for anybody who hasn't done it, it's very frustrating, but which also gave me a sense of empathy for, parents who have been at home trying to help teach their children, or people who have had to figure this out to do their jobs, that you just have to keep working and listening to videos and until you become familiar with it. And it does seem overwhelming at first, but then once you get the hang of it, it's like most other things we learn as adults. When it's new, it's difficult for us. And then as we continue to use it, we know more about it and are able to talk people through it and be more help with them. So I think that my experience I felt a sense of accomplishment once I was able to feel like I was comfortable using my new platform and be able to talk people through.
I mentioned to you earlier when just you and I were chatting, I could tell immediately that you were experienced at this platform because you maintain such good eye contact with the camera. And that's something I'm still working on because it's so tempting to
right.
do, one of these. And I know another one of the hints or suggestions to reduce Zoom fatigue was to turn off your own video so that you're not looking at yourself.
That's true.
As much. And one of our former colleagues, Martha Teeter, pointed out, she says, we don't have mirrors sitting there that we're looking at in a live situation. We really don't see ourselves.
Right.
And that again can be a pretty big stressor if you're always looking at yourself and worrying about how you're coming across and things of that nature.
That's true. And, some of the other things, the tips that I saw about to address Zoom fatigue is to build mini breaks in your day so that you can get up and move around. And just like you said, turn off your own video. If you can just listen, that is less cognitive work than looking and listening, because I thought it was interesting. I feel more comfortable being able to see a background behind me, but they talked about on there that that causes more cognitive processing and it causes you to be more tired because not only are we looking at the person speaking, but we're examining everything that's behind us.
Right.
Yeah. And so it makes us more tired than any normal interaction would, because we'd only be focusing on the person if we were together in real time.
Right. And everything is focused cognitively as opposed, it's not the same emotional connection to your surroundings out there, olfactory and all our senses that we normally would use in a face-to-face situation. So everything it comes back to what we're catching here.
Right.
And that's that cognitive overload that can lead to Zoom fatigue for sure.
Right.
Are there things outside the office that you do to personally take care of yourself to reduce some of the Zoom fatigue, stress load, whatever you'd like to call it?
Yes. I walk. And if I'm having a stressful day and the weather permits, sometimes I may take a walk during my lunch break. I use guided meditation. There's a great app and it's free. It's called Insight Timer that has, last time I checked, over 80,000 free meditations. And they have them on almost every topic. So if I want one for the morning to get the morning off to a good start, there's morning meditations. There's meditations to help you sleep. There's meditations for just about any topic that you would want to find, and it's all free. And so doing those during the day, even if it's just a 10-minute break, kind of is a reset cognitively for me, because it works on your breathing and sometimes on using your senses to kind of tune back into the real world rather than being up in our head all the time.
All right. Okay.
Yeah.
Good. Yeah. Outstanding. Is there, I know our time's beginning to run down here. Is there anything that we've not, looking at my notes here, we seem to have hit most of my notes. Have we missed anything that you think would be helpful to our colleagues out there or whoever may be watching this video down the road?
The only thing that I think I talked a little bit, or we talked a little bit about this at the beginning, I just made a short list of some of the benefits to this. And I know I mentioned like the cost of getting here, but the privacy, not having to leave or having it in your car, nobody knows where you're going or what you're doing. There's more flexibility with scheduling usually, because if you have only an hour and you can go walk to the parking lot and have your appointment and come right back in, you've not had to change your schedule for work or ask for time off. And it does help people who don't have access if they're in rural areas, so that they don't have to drive so far, so there are some benefits to this. And I guess that's something I should have said at the very beginning, is even though there are some drawbacks to telemental health, it is definitely better than not being seen and feeling so isolated, because at least you can have connection with your patients in a time that has been so uncertain and so full of unknowns. At least if it's something, you at least have a connection in this way with a provider, which you may not have had access to otherwise.
Right. And as you well know, in our geographic region here in Western North Carolina, broadband internet services aren't available at every home.
That's true.
And so often people do have. I've had folks drive to an overlook where they could get a strong signal to get their assessment done, as an example. So, yeah, but it kept them from having to drive the other 30 miles or so to town and then all that back home. So, yes, pros and cons for sure.
Right.
If someone would like to get hold of you for some services, would you share how they might do that?
Sure. My telephone number is 828-550-0531. And I do individual services. I do work for businesses, either for team building or to do a respite retreat. And I also offer expressive arts therapies as well. You can see in the background my sand play therapy, and I do some other expressive arts work. So yes, if you would like to get in touch with me for a consultation, just give me a call.
All right. Well, excellent. Well, Lynne, thank you so much for being with us today and for sharing your expertise and experiences having served our veterans and their family members, as well as our citizens. It's very much appreciated, and we'll be seeing you very soon, I hope.
Okay. Thank you, Cecil. It was nice to be here.
Thank you. Bye-bye.
Bye.